being here.
Thank you so much for having me. Thank you for the invitation. I'm very excited to be here, and I was late, and I do apologize, but it turns out it worked out for me because you heard from this really awesome panel. What are the problems? What are we doing to solve some of the problems? And what is the future of how those problems will be solved with or without doctors and their house calls, right? HEAL is I consider it one of my kids. In fact, I created this company after a horrendous experience being a patient at CHOC with my children, being a patient at UCLA. Even last week, my little daughter was hospitalized for a week. It was another traumatic experience for me. And so this company comes from not just being a doctor, I'm a practicing nephrologist, but it also comes out of sheer love for the practice of medicine and for the importance of how being treated as a patient is in what's happening with all these changes that you've already heard about. I wanted to start with a really quick video. I wonder if it can be played. Okay, so I feel like that was my whole talk, so maybe I could even take questions. So I wanted you to see that video because it's not so much that I want to spend my 20 minutes or 15, whatever's left, focused on what are the problems in healthcare, but I really wanted to focus on how we're thinking about solving those problems. And so what we initially started out as is an urgent care on wheels, a mobile urgent care. I started a family 10 years and several years into my marriage, and it was disastrous for me. I was driving home from an emergency room one night with my husband after, wasting a bunch of time. And I said to my husband that, I want to get to a place where, as a patient, I know what the hell is going on, but as a doctor, I can feel confident that I'm delivering the best possible care. And in order to do that, I need time. It can't be that it's Friday night, so I can't help you go to the ER, right? So my husband and I started this company together about 5.5 years ago, and at the time, this is what we did. I used to make him drive me around. I turned him into my medical assistant. I taught him how to take blood pressures, and I would go from house to house in our neighborhood, and we would charge $99. We've grown a whole lot in the last 5 years, and what we've done, some of which I showed you in that video, is we've proven to some degree, we have a lot of work to do, a concept that the best care comes to you. And so what we've focused on, and our mission, is to deliver access to care. And so while all of us in the room, by and large, 85% of us are relatively healthy, and we know how to get access here in Orange County and in Los Angeles. There's a whole country out there of children who aren't getting the vaccinations they need, seniors who do not have smartphones or Wi-Fi, right? And so how are we getting access to those people, and how can we use some of the internal software that I showed you that we have built to build on that promise, and most importantly, become the primary care physician? So in 5 short years, we've gone from being an urgent care to a primary care. So, and some of you might have even seen our little tiny cars driving around. We started in Los Angeles, California. We are now operational in these states. We've also recently launched New Jersey. And here are some of the folks that we work with, right? So when we started, this was a cash pay service. And now we are in network with basically every major payer in each and every state in which we operate. This is really important. 5 years ago, we sent a cold email to one of the benefits managers at Google, and we said, hey, we want to take care of your employees so they don't Google what's wrong with them and they don't Google where the nearest urgent care is, right? That Google relationship is how we became exciting to payers like Anthem and Blue Shield and Aetna. And with those relationships, we are now managing risk. We are the PCP for a certain percentage of patients in a community. We look at, when we launch a market, we look for those relationships, and we have a lot of density to start so that our doctors and MAs are not driving all over the place. We've delivered to date about 150,000 house calls. We are improving by things like AI our closure of care gap. What that means is just because a patient calls us and says my belly hurts doesn't mean we don't order the mammogram or check the vaccine record. So even though it's one by one, house call by house call, we are making sure that patients get the kind of care they should have had, right? All those missed opportunities that they couldn't have managed in a 15-minute office visit. We are noticing that our patients are not using the emergency room anymore. So at this point, we have several thousand patients on our panel, and we are observing that 65% of the time, when they could have gone to the urgent care or even the emergency room, they are using our service instead, right? So that means that ERs and urgent cares are no longer unnecessarily dealing with that which is not an emergency or an urgency, which is fantastic. That means less infections spreading through those places of business. We find that about 26% of our patients are not needing the hospital as much. So for example, we launched this service in January of 2019 in Atlanta, Georgia. And if you were to look at the 100 sickest patients on one of our payers' rosters, you would see that actually probably closer to over 35% of the time, they are not going to the hospital for CHF or for COPD. They are staying home. And we are using telemedicine, we are using the Heal Hub, which I described, which you saw described in the video, to monitor our patients. And so we're heading towards this concept of hospital at home. Our clinical capabilities are pretty vast. There are silly things that you would think we should be able to do, but honestly, it's not good for the patient, right? Sometimes if we need to get a specimen, it's not a clean environment, right? We need to have a sterile field, or we need to have no pets and fur and whatnot. We're in New York, right? That's city living, building living, or San Francisco. There is no space necessarily to be doing pap smears. Right? So these are kind of interesting things that we did not foresee as an issue. On the other hand, we bring our own kit and we do a fair bit of care delivery at home using what, any person who's a physician certainly is looking at that picture and not seeing any high-tech items up there, right? We use the standard ophthalmoscope, the stethoscope. We are examining our patients just the same way, that an old-fashioned house call doctor was doing. And everything we do, we are a HIPAA-compliant company. These are some of the things we can do in a house call, right? So you can see there are certain urgent care things on there. There are point-of-care testing things on there. But more interestingly, we're also getting to a place where we're doing very comprehensive care. So 5 years ago when we started, we wouldn't think of delivering vaccinations or hearing or vision exams. Now we have a base of patients that depends on us to deliver that kind of care. We also have a base of patients for whom we need to care for the guardian's needs, right? If that patient needs supplies or whatnot. This is a standard Medicare visit. Every single Medicare visit has what a physician would do to close care gaps. And so we're very focused on some of the things that would be missed in a 15-minute office visit, right? Did we do our best to send the patient out for their osteoporosis screen, or did we check their blood pressure? And we're doing the same for children. Again, there's a big focus on vulnerable populations. And last, if you want to deliver access, there is no way you can consistently deliver a doctor or a nurse practitioner, and we know that. We're building software that allows for telemedicine visits, right? Not every patient has a smartphone. This means a phone call is the way you're delivering access, right? Not every patient has a tablet or a $1,000 iPhone. How are those folks getting access? We are trying to build software that allows us to dispatch care by phone or by, honestly, sending a van into a community and doing as many testing sites as we can. So here's a little bit how we think through seeing a patient from the moment we do a health risk assessment. All of these are parts of our software that we have built so that internally we are taking that patient's care through our platform to make sure their loops are closed. And this is a little bit more about how we are using automation to deliver that care. I want to get to, oops, I wanted to do that slide. So the last thing I'll say is we allow patients, to this day, we have an 800 number at HEAL, right? So we allow patients to call for their visits. We allow them to use the app or the website. We help them book the visits. We help them get their insurance loaded. So many of the things that should be, in our minds, simple are not simple for patients. At the end, they might get an explanation of benefits and have no idea what the explanation is or why they were charged accordingly. So we're slowly building software that doesn't even force them to deal with that part of their evaluation. Everything becomes real time, and they are held, their hands are held to even pay for their visits, so after the fact, they are not receiving a bill. Last, I'll just conclude on the point that we have worked very hard in our markets to become the primary care for these folks. We've used a fair bit of AI to grow our populations this way. And we're looking forward to see how much further we can take care in the home. And we're wondering and we're hopeful that this is going to be where the best care is received, that patients will stay home for hospitalization, that patients will stay home for their echocardiogram, their EGD, their fillers. This is the sort of software we're building over time. Thanks very much for having me.